The following episode is brought to you by the American Urological Association. This special episode is all about the Society of Benign Prostate Disease meeting at the 2026 annual meeting. Keep listening to hear about the agenda and the main clinical areas being highlighted from Dr. Kevin McVary, President of the Society of Benign Prostate Disease.
Welcome to another episode of AUA University Podcast. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education. Today we're focusing on an area that is foundational to nearly every urology practice, benign prostate disease, and specifically the upcoming Society of Benign Prostate Disease meeting at AUA 2026 in Washington, D.C. BPH and lower urinary tract symptoms represent one of the highest volume practice-defining areas in urology. And importantly, this space is evolving quickly with new technologies, expanding minimally invasive options, and ongoing debates about durability, patient selection, and value. I'm pleased to be joined today by Dr. Kevin McVary, Professor of Urology at Loyola University Medical Center and President of the Society of Benign Prostate Disease. Dr. McVary is a recognized leader in the field and has been instrumental in shaping both the science and clinical management of male lower urinary tract symptoms. Kevin, welcome. It's great to have you with us today.
Thanks, Mark. It's a pleasure to be here.
So let's start at a high level. What is the Society of Benign Prostate Disease, and what unique value does it bring to urologists, both in academic centers and in community practice?
Right. So we're I'd say the newest, or certainly a newer society within urology. It was formed by myself, Dr. Kaplan, Steve Kaplan, and Klaus Rohrborn in 2019. And as you mentioned, a substantial portion of general urology, around 50%, is focused on non-malignant prostate diseases. And it reflects really the high prevalence and the impact of these conditions on men's health. And when you look at the global burden of disease, and that would be like the years living with disease, for LUTS BPH, it's greater than the burden of all other urology diseases combined. So our goal in the society is to improve the awareness of non-malignant conditions of the prostate and their considerable burden to both the individual and the society at large. Read that as health policy. Also, our focus is to promote ongoing research into the epidemiology, the pathophysiology, and the natural history of these conditions in all countries, not just North America. And we intend and are spearheading research into newer and more effective, but very likely less invasive treatments for these conditions.
You know, that's really helpful context, and it underscores why a focused society in this space is so important. Let's turn to the upcoming meeting. All right, Kevin, looking ahead to AUA 2026, what can attendees expect from the SOBPD meeting this year?
So research in LUTS BPH and other non-urologic and other non-malignant diseases is exploding. And this is because of a number of factors, the demographics being a critical one. And our meeting is laser focused on these important societal, technological, and scientific trends. Our agenda for the meeting is wide-ranging and addressing many of the critical controversies and the developments in male health.
Great. You know, for a busy clinician, we know how hectic the AUA meeting can be and how much information is out there. And so for someone who may only be able to attend one or two sessions, what would you say are the can't miss elements of the SOBPD program?
I'd say there's 3 or 4 that are critical. One is management updates. And management updates in the first is, again, natural history and epidemiology. And my request to an attendee is to ask him or herself 3 questions before they join us. One is, what is the epidemiology? What's the natural history? And how does this epidemiology and history of LUTS BPH affect disease burden on a global scale? We intend to help answer that. Also, we're going to offer practical updates on the newest diagnostic techniques in urology in LUTS BPH, and that's primarily office-based technologies, non-invasive office-based technologies, UroLift and Glean, a wireless non-invasive urodynamics technique, are probably the best examples of that, but others as well. And then a focus on the newest data on prostate MRI for benign prostatic diseases. We're going to focus on comparative evidence for the exploding world of minimally invasive surgical treatments. I mean, it's just a host of initials, but things like UroLift, Greenlight, PVP, Optilume, Resume, Aquablation, the various TERP variations, and then simple prostatectomy and HoLEP techniques. And then lastly, BPH surgery in the complex patient. If ever a BPH specialist is challenged and asked to help out, it's going to be one of these complex patients. Well, what are you talking about? I'm talking about surgery in the anticoagulated patients, men with prostates, let's say excessive of 200 grams, so really quite large, and then very troublesome, the post-radiation man with LUTS. So, it's a lot, but it's also quite focused on, I would say, what are problem areas in our field.
Oh, it sounds like the focus is really going to be on delivering high yield practical content that everyone can take back to their practice. Let me pick your brain for a moment and pause and ask something from a practical standpoint. You've described a lot of content. Where do you think the biggest disconnect might exist between guidelines and what's actually happening in real world practice?
Well, certainly addressing the newer technologies, our guideline process, of which I was part and parcel for more than 16 years, chair for a large portion of that. Evidence-based, it's rigorous, it's doing all the things at the very highest level. Our field is rapidly evolving. In a sense, the guidelines can't keep up with all this rapid development. So it's a challenge. The society wants to be part of addressing how to really better manage these rapid developments.
Thank you for that insight, and I appreciate your perspective, and I'm sure the audience does as well, because it's a critical point, right? Especially as the number of available treatment options continues to grow, not only in number, but also, as you pointed out, in speed. Things are just happening so quickly in our field.
Mm-hmm. Mm-hmm.
So, let's shift to what's coming next. Okay, what is new or most exciting on the horizon in benign prostate disease?
Yeah, so I'd like to say that benign prostatic space, it's in a golden age. It's in a golden age of expansion with new technologies bursting on the scene, like we've mentioned. Really a better understanding of the etiologies, plural, of LUTS BPH and risk factors also driving the disease. And that would be a focus on modifiable risk factors. All this is driving attention to our field and really to these diseases. For instance, right now, there's 8 randomized control trials focusing on nitinol devices of different kinds and different strategies, which have either just received FDA clearance or they're completing their pivotal enrollment. That's a lot of innovation. So how do you get to this really important juncture? It's really a fortuitous intersection of need, basically disease burden. 2, demographics. We know about the demographics of Western society and how we're really the post World War II baby boom is really coming into our field. And then most importantly, collaboration between urologists, scientists, and biomedical engineers and industrial partners, and those that are well established and those that are involved in creating new companies and new innovative ideas.
Great. And as you think about where the field is heading, A question for you that I have is, do you see moving us toward more individualized treatment algorithms or perhaps more toward greater standardization of care?
Well, I'd say the standardization of care would very likely be focused on understanding the specific phenotype of the patient, and that is individual care. So really, if it's not doing both, we're kind of missing the boat. We need to do both. And are those opposing forces? Not really. I mean, not if you take the 10,000-foot level. No, they're actually the same thing. And I think it can be done.
That's great. And it's fascinating to see how quickly the space is evolving, particularly with the intersection of technology and, as you pointed out, patient-centered care.
Right.
So let's close with a practical takeaway. All right, Kevin, if you had to leave our listeners with one key message, what would you want every urologist to take away, both about the SOBPD and about managing benign prostate disease today?
So I can't do it in one, but I'll do it this way. One, a warning, and two, hope. So Let's BPH, it represents the largest demand on first world urology resources. I've mentioned that before. And this is posed to really accelerate in the future. And this is beyond population-based estimates because men are living longer. They're surviving other diseases only to graduate to Let's BPH. The urologic workforce in the U.S., particularly and Western world, it's becoming inadequate to keep up with these increasing demands. Therefore, preventative, complementary, and cost-effective treatment strategies, they're critical to combat these problems and these imbalances between patient need and doctor resource. We like to think that the Society for Benign Prostatic Disease is best poised to tackle these challenges.
Oh, excellent. Very actionable and highly relevant. I don't know if you have any final thoughts for the listeners in the audience about the upcoming annual meeting and SOBPD or other things that you mentioned today regarding the new technologies.
Well, we're a growing society. We went from 3 to over 200 since 2019, and that includes during the COVID pandemic. Talk about bad timing. Anyway, we want new members. We'd like to see urologists attend our sessions. It's very popular. Sometimes it's been hard to get a seat. So we'd really like to see new urologists attend our meeting.
All right. Well, listen, we'll look for the standing room only sessions and attendance at the upcoming meeting. Kevin, this has been a terrific discussion. Thank you again for your insight and for your leadership in this field. I think a key takeaway for our listeners is that benign prostate disease is no longer a one-size-fits-all space, right? It's increasingly nuanced, technology-driven, and patient-centered. And meetings like SOBPD at AUA 2026 are important for staying current and for delivering high-quality care. And to our listeners, thank you for joining us. For more educational content, including podcasts, courses, and clinical updates, visit auanet.org/university. I'm Dr. Mark Gonzalgo, and we look forward to bringing you another episode of the AUA University podcast.